Okay, good morning, everyone. It's Friday the 28th, so I hope everyone's well. This is being recorded so that people can watch this at another point this morning. I hope everyone's well. So, in terms of updates this morning, I've got quite a few things which I wanted to talk about. I did say I'd focus slightly on flu today, so I will cover that slightly and again next week. But I just wanted to give you some really key updates about radiology. There's been lots of questions about that this week, and I think that's really important that I tell you. So, as you may have known, we have been sent an email from the Royal Free London to do some reprioritisation work, which has now been agreed by clinical directors and the LMC. And so practices would have started receiving some sort of emails from the Royal Free to start reprioritising some of the ultrasounds. And what that means is that they're sending us old ultrasounds, which are generally several months old, which we would have requested in the practice, and asking us to review whether those patients still need those ultrasounds, or they may have had them elsewhere in health, or they may have also been duplicately referred. So sometimes if we hadn't heard for a scan for a patient, we've sent it twice. So as you know, and there was discussion at NCL because as Barnet GPs, we felt that this was non-contractual work, and so therefore we went in to discuss this with the CCG, and the CCG had agreed to reimburse practices financially to cover the costs or the time taken, or whether if you had to take a session out and needed a locum, you'd be reimbursed. So yesterday I got confirmed from the CCG that they will pay £110 per hour to GPs to review this work. What it does mean is that there needs to be a minimum of 6 ultrasound scans reviewed and rag rated. Now, it may mean that you have to contact some patients. So I did 12 yesterday, and a couple of those patients had them done. So I didn't even need to contact them. I just wrote down rag rating black, and black means it's no longer needed at the Royal Free. And when I say they had them done, a couple of them had them done at in health. One was a duplicate referral, one had gone private, lots of different variety of things. And then for the remainder of those patients, we were rag rating in red, amber and green. Red is we were really worried about this patient, and probably there shouldn't be many that are red, I would have thought, because they should have been done. And then amber, if they sort of need to be doing in the next month or so, and green if they're very routine. What's also really important is that we also got the Royal Free to agree, because as you know, there was a blanket rule at the moment that we can't refer anyone to the Royal Free in Barnet for ultrasound scanned. But colleagues had flagged that in health are not able to scan anyone under the age of 18. So on Wednesday, I had a conversation with the Royal Free, and they've agreed that they will accept referrals for those under the age of 18, and they'll accept red referrals where you think somebody might have suspected cancer and you're doing a scan clinically appropriate rather than doing a 2-week wait. Anything that's amber and green should go to in health. Now, colleagues yesterday flagged that in health were rejecting referrals. So I also had a long conversation, 30 minutes yesterday, with in health. And in health have absolutely assured us that they're not rejecting any referrals. And if the GP has had a referral rejected and has been an error, they're happy to investigate that, and you should follow that up with an email to the NCL quality team, who can forward it to in health. Now, of course, if you wrote something that was clinically inappropriate, like anyone, they would reject, and have been doing that pre-COVID. The numbers are low. What's really important within health is that, again, we rag rate it amber and green. They don't do any urgent cancer-like ultrasound, so don't send anyone who you think got a red rag rating. And what they're saying is that the wait time currently is 6 to 8 weeks for an amber stroke green scan, and for MSK scans, so they could be up to 12 weeks wait in health currently, while they help sort the backlog out. And I think the only message that I really kind of wanted to take back, that, you know, I had a long chat with secondary care and in health, and the only thing that I thought was quite important about what they said was about when we put clinical information in. I think that's really the key thing to allow them to help prioritise the work. So I think when we're thinking about what we write in the TQuest box, we could maybe reflect on ourselves to help ease the burden, and that is just to really say, what are we asking in that ultrasound scan? Is there enough clinical information? in that box that we put in. And just to remind us that ultrasounds are generally performed by sonographers who are not medically qualified. So it's really a good idea to put down suspected diagnoses rather than pain query cause. So say something like query gallstones or something like that, so that they know what to look for. And I think that's the only feedback that they had. So when they were looking at the clinical information, some people had just written down abdo pain query cause, or iliac fossa pain or pelvic pain, and there was no kind of sort of idea of how they could prioritize those patients. So I think that's really important for us to take back as well. The next thing I wanted to talk to you about this morning was pediatrics. So an NCL review has concluded that staffing levels are challenging to be able to maintain safe and resilient services for children and young people, and therefore they've been doing a review of the emergency departments and inpatient units across NCL secondary care. And I can now tell you that Barnet Hospital, as I told you on Tuesday, had reopened on Monday, and that's including the Child and Adolescents Mental Health Services Crisis Support that opened on Monday. However, the Royal Free Emergency Department for Paediatrics and Inpatients is still closed. The Whittington Health Emergency Department inpatient will now be expanded and possibly become a NCL secondary care hub. And Great Ormond Street will provide an enhanced role for elective inpatients and some, but not all, day surgery, and they'll be building on existing arrangements. And also to update you that the emergency department and inpatient unit at North Middlesex University Hospital remain open. University College, that's UCLH, will continue to provide specialist inpatient and day case services, including the cancers, but the UCLH Paediatric A&E department will remain closed until further notice, and certainly till the end of this year. There's been a discussion across the NCO with senior leaders across the NCO and NHS England, and I understand that LMC are aware that they're looking to permanently close the UCLH emergency department, possibly North Middlesex, and make a hub at the Whittington. My understanding is that Barnet Emergency Department for Paediatrics will remain open in that deal. The next thing I wanted to tell you about was just a key thing about the new NHS scheme for allowing people who previously may be caring for children or families to return to work. And this is for anyone who's taken a break from their career, can now be given a £2,000 financial support to complete any necessary training if they've been out of practice for a while, and to help with childcare. So that's a new thing that's coming out from September. The next thing I wanted to talk to you about was flu. So earlier in the week and last week, I gave you some ideas about what we're doing with flus, and in particular, an outdoor model is being proposed across practices right now. And especially with the uplift we've got financially, I think we can probably cover costs of gazebos, marquees and things like that for an outdoor model. But I just wanted to let you know about a change in a vaccine as well for children. So generally for children, we give the nasal flu, but this year there is an alternative vaccine for children that can't tolerate a nasal flu. However, as of Wednesday, it was announced that there is a delay on this vaccine, or a shortage of the intramuscular vaccine for children under the age of 18, and that will not be available until November. So I think that's really important to make any parent aware. It's just that maybe the child doesn't like the nasal vaccine, then they should really have the nasal vaccine, because the other one, the intramuscular, might not be available till November. Of course, if someone has an anatomical problem or a real clinical reason they can't have the nasal one, then they'll just have to wait till November. And probably if we've got very low numbers, I mean, I can't think of any patients that we've had that have not been able to tolerate the nasal one, but there obviously will be a few floating about. So thinking ahead about flus, what we should be doing now is our flu jab should be arriving in the next 3 or 4 weeks in practices, and really it's about how we're going to set up clinics. So there's a couple of ideas floating about, and one is that you have timed appointments according to alphabet. The other one is to think about barcodes. Barcodes were one of the things that are floating about in primary care, about giving people a letter with a barcode on it, and they bring the barcode, then you've got scanners. The problem is if you're doing an outdoor model, you might not be able to do that because you're not going to have computers outdoor. So there's ways of doing that, ways of working around that. The other thing is to make sure we've got red bag facilities outdoors. So you've got emergency facilities. Do you have privacy screens? Do you have seats? And these are all the logistics that we need to start be thinking about over the coming weeks. And I'll just remind everyone for the weekend to go back and have a look at the RCGP flu plan and the one at CQC if you're looking to move locations, because those talk to you about how many vaccines you can theoretically do per member of healthcare staff in 1 minute, 5 minutes, 10 minutes, and then allows you to plan for workforce and numbers. And then secondly, what requirements CQC have if you're doing it in your own car park, or if you're going indeed to Tesco's car park or something like that. I shared those with you last week, and they'll be in the chat bar, but if you need to look at them, then go back. The very final update I wanted to just give you a heads up about is I mentioned, which I forgot to mention to you, I was just going to re-mention to you, I mentioned that Royal Free will be accepting red ultrasound scans, and there is a form being developed right now in the NCL which will allow us to organise an urgent ultrasound scan when we're suspecting cancer. And so what that is there'll be a form, will be on Bar Global, and we'll just email it to the Royal Free. So if we don't want to do a 2-week wait, but we think someone needs an urgent scan within 2 weeks, we will now have direct access to those types of scans. And that will include CT abdomen for query pancreatic cancer. And that form can go to the Royal Free or UCL or Whittington, Northmead or wherever. So it'll be an NCL form. So that will be quite a new thing that's coming out. And it will just be for query cancer, where we want to do a scan before we do a 2-week wait. Because, for example, we're not sure what kind of cancer this patient might have. And in the absence of an MDC at the moment at UCH, I think this direct scan access will be welcomed by primary care. I'll share, the form is in draft, and I'll share the final version of the form once it's been ratified, probably on Tuesday's webinar. I've run over a bit, so I'm going to say if anyone's got any questions, pop them in the chat bar. Ogie, you said there's already a form on the direct access. Yeah, this will replace that one, and it will be an NCL form for query cancer direct access. So that will come onto Bar Global, and we're expecting this to be live probably by the end of next week, I would have thought. But I'll give you an update on Tuesday, and I think we're planning on getting it live by Wednesday, Thursday next week. And I'll share more details on Tuesday. Finally, if you wanted to know about bank holiday pharmacies, there are 3 pharmacies open on bank holiday, and they will be, there are 3, one is in Finchley Memorial, which is the Fairview, one is in Cricklewood, and the other one is in High Barnet. So if anyone's working on bank holiday Monday, there are 3 pharmacies guaranteed to be open all day on Monday. Otherwise, have a fantastic weekend, and I'll see you all on Tuesday.